Hi, I'm Congresswoman Terri Sewell, and I proudly represent Alabama's 7th Congressional District, the Civil Rights District, which includes the historic cities of Birmingham, Montgomery, Tuscaloosa, and my hometown of Selma, Alabama. I want to thank Less Cancer for inviting me to join you for today's 2023 National Cancer Prevention Workshop. I'm proud to call Less Cancer a partner in the fight to eliminate health disparities and pave the way for a world without cancer. The past 2 years have been like no other, given the threat of the COVID pandemic. COVID-19 put a spotlight on health disparities, but we didn't need a pandemic to know that. Since coming to Congress in 2011, reducing health disparities for underserved communities has been a top priority of mine. And as co-chair of the Ways and Means Racial Equity Initiative, I have fought to bring health equity to the forefront of our policy agenda. Tragically, cancer takes the lives of over 600,000 Americans every year and disproportionately impacts minority and rural populations due to the high rates of late-stage diagnosis. We know that one of the most important ways to beat cancer is to catch it early, before it spreads. If you or your loved one is diagnosed with cancer, the very next words you want to hear are, "But we caught it early." Until now, our tools to catch cancer early have been limited. But today, thanks to cutting-edge advancements, new blood-based cancer screenings are emerging, which hold the promise of catching cancer earlier than ever before and treating it before it spreads. Unfortunately, unless Congress acts, it could be a decade or longer after FDA approval before Medicare has the authority to cover these new cancer screenings. Just as Congress has acted in the past to create coverage for mammograms and other screenings, we must act again. My bill, the Medicare Multi-Cancer Screening Early Detection Coverage Act, would help us do just that. This legislation would modernize Medicare coverage to enable providers and seniors to access early detection screenings after they are FDA approved. The premise is somewhat simple, but it would make a big difference for the thousands of families who face cancer diagnosis each day. At the same time, it would help reduce the glaring disparities in cancer deaths between racial groups. Thanks to our persistent advocacy, this bill received bipartisan support, a majority of bipartisan support in both House and Senate in the 117th Congress. I pledge to continue in the 118th Congress to continue this fight to make sure that it's passed and signed into law. As we enter this new era of cancer screening and treatment, we must ensure that the benefits of these new tools are felt by all of our people, especially rural and underserved communities, which have been historically left behind. That means being intentional in ensuring that equity is at the center of our policymaking. I applaud the Less Cancer Board for shining a spotlight on health disparities during today's event. What keeps me going is knowing that what we do today will save countless lives years from now and pave the way for a world free of cancer. To the scientists and experts at today's workshop, thank you for your commitment to this worthwhile cause. I firmly believe that these new technologies and advances in early cancer detection is going to be our best chance to save lives and reduce the burden of cancer. Together, let's continue this fight until cancer as we know it no longer exists. Thank you.